The largest professional oncology association in the world, the Oncology Nursing Society, is dedicated to promoting excellence in oncology nursing and quality cancer care. A leader in providing educational opportunities to oncology nurses worldwide, ONS offers its members useful information at all levels, in all practice settings, and in all subspecialties.
The mission of the Oncology Nursing Society is excellence in cancer nursing and quality cancer care. So hence twofold, both focused on the profession and the patients that we serve.
ONS was founded in the early 70s by a group of nurses who realized the emerging field of oncology nursing and recognized the need to come together for education, support of one another, and developing the competencies and standards and practice that was going to be the future. The organization has grown through the years based on values such as excellence, inclusiveness, stewardship, advocacy, and these really ground us as an organization and really foster our mission of excellence in oncology nursing and quality cancer care.
According to recent statistics, more than 1.4 million new cases of cancer are diagnosed and treated in America each year. The majority of this care is provided in an outpatient setting or during relatively short hospital stays, administered and coordinated by skilled, caring oncology nurses.
What patients and families may not know at first is that most of their care is going to be provided in the outpatient setting, whether they're receiving chemotherapy or radiation therapy, and they will be seeing nurses very consistently throughout their treatment phase.
Brenda is president of the Oncology Nursing Society, an organization made up of over 37,000 registered nurses and other healthcare providers dedicated to promoting excellence in patient care, education, and research in oncology nursing.
The vision of ONS is to lead the transformation of cancer care. By that we mean working collaboratively with other healthcare professionals to prepare the profession for the future. Oncology nurses serve to help patients and families navigate their way through a treatment and living with cancer. They make a difference in both administering treatments to patients, helping them to manage side effects, but a critical role that nurses play is helping to educate them about their disease, about their treatment, how to cope with and manage life with cancer. The shortage in this country is critical not only of nurses, physicians, and other healthcare professionals. So one of the things that ONS does is we work with the National Student Nurses Association to help educate young nurses about a potential career in cancer care, to help them see what a wonderful contribution that can be in their professional life. Outside of that, ONS likes to position itself as a resource to those professionals that are providing cancer care that may not consider themselves a specialist.
Oncology nurses play a critical role in the delivery of quality cancer care, serving as the strategic link between the physician and the patient's caregiver at home. Their focus on patient education helps guide a cancer patient and their family through the treatment regimen and beyond. Success in cancer treatment results in a growing number of long-term survivors whose ongoing care and patient education is delivered by oncology nurses.
The nurses will explain treatments, what patients can expect, how to manage side effects if they're having side effects, and throughout the treatment they'll reinforce this teaching with patients and their families so that the patients and families won't be sitting at home worried, wondering, is this normal, is this not normal?
Being a member for over 30 years on and off, I've seen the organization grow with a lot of good expertise about nursing and really propelling nursing into the future. Everything now is based on evidence and research, and it's exciting to be among people who are leaders in that area, and it makes me strive to be better as well.
One of the things ONS is most proud of is we have a textbook, Chemotherapy and Biotherapy Guidelines and Recommendations for Practice. This textbook is available to both members, non-members, but in addition serves as the foundation for a course that ONS has on a regular basis provided to nurses throughout the country to learn how to safely administer chemotherapy to patients. We also have our ONS Foundation, which has funded over $20 million for nursing research in its history, is the second funder outside of the U.S. government, in basically supporting nurse scientists in doing the research that serves as the evidence base for our practice.
A career in oncology nursing is one of the most fulfilling nursing subspecialties that there are. If a nurse is interested in developing relationships over time and long-term relationships with patients, this is the perfect subspecialty in nursing because you work with patients and families over months, sometimes years, and those relationships are incredibly rewarding.
What we hear from members is that ONS really serves for them as a professional home. It's an ability to network with nurses that are doing the same thing that they're doing, that carry that passion for treating patients with cancer and helps them to become better professionals.
As a professional, you need to support the profession and yourself, and Oncology Nursing Society allows you to grow as a nurse and to meet people from all around the world with similar issues and challenges. It's an ideal organization. I truly do believe in it.
It's very helpful to anyone, no matter what part of their career they're in. There are mentorship opportunities for newer nurses to shadow more advanced nurses. There are scholarship opportunities, money for research projects, and just numerous opportunities for nurses to take advantage of.
I believe that the Oncology Nursing Society offers so many benefits to nurses who are cancer care nurses, whether that benefit is education, whether it's leadership development, whether it's being part of a diverse group that advocates on behalf of patients and families. That's why I would say nurses should join our society, and why 37,000 nurses have joined our society, because they understand the benefits to them and the benefits to their patients and families.
I think that what I like the most is that I'm actively contributing to oncology nursing, that I am helping my patients by bettering myself, by learning more about oncology, keeping up to date with the treatments, and kind of helping move the frontier of oncology nursing forward and making positive changes.
Advocacy is most important when we think about the role of the society and the profession on Capitol Hill, for example, advocating for legislation and issues that are important not only to the profession, but also to patients for access to care. For example, ONS has sponsored a bill that would ask for Medicare to pay for patients to receive education at the inception of treatment. It would teach them about their treatment, how to manage symptoms and side effects, and what kinds of things they should report to the healthcare team. When you receive a diagnosis of cancer, it's a very frightening word for people to hear. People oftentimes feel that it's something that will be completely unmanageable. And one must always remember that cancer is a disease, but it has impact upon each individual person in a different way. So oncology nurses help families navigate through that and make what feels unmanageable, manageable.
The Oncology Nursing Society is an organization developed by its members and providing services to its members. We are an inclusive group with nurses representing all different sectors of the cancer care continuum. And we are very responsive to the education, support, and leadership needs of our members.
Learn more about the Oncology Nursing Society today, where oncology nurses connect. Call 866-257-4ONS or visit ons.org for more information.